And welcome back to the cross-examination in court of the nurse Lucy Letby. Just as a reminder before we start today, Lucy Letby is currently standing trial accused of the murder of 7 babies and the attempted murder of 10 others at the Countess of Chester Hospital's neonatal unit. She has pled not guilty to all charges. Nicholas Johnson KC for the prosecution continues to cross-examine Lucy Letby in the case of Child I. He moves on to the third incident on October 14th, 2015. Mr. Johnson says Letby does not refer to this incident in her statement. Letby, in her evidence, said she did not recall this night. Letby rules out staffing levels, medical incompetence or staffing mistakes as a contributory factor in the collapse of Child I for this incident. The staffing rota for October 13th to 14th, 2015 is shown to the court. Letby is in room 1 as the designated nurse for Child I. Joanne Williams is the designated nurse for 2 other babies in room 1 that night. Letby is asked to look at her nursing notes for that evening. Mr. Johnson says Child I was tolerating handling and tone appears improved according to Letby's notes. The notes add, quote, "At 0500, abdomen noted to be more distended and firmer in appearance, with area of discoloration spreading on right-hand side, veins more prominent. Oxygen requirements began to increase, colour became pale, gradually requiring 100% oxygen, blood gases poor as charted. Clear air entry, slightly reduced on left, chest movement reduced, continue to decline. Reintubated at approximately 0700, initially responded well. Abdomen firm and setended. Overall colour pale. X-rays carried out. Resuscitation commenced as documented. Night and day staff members present." Letby says she cannot recall a discoloration now. She does not recall it moved, but it was spreading by getting larger. Nicholas Johnson: "Where did you get the time of 5 o'clock from?" Letby: "I don't know. I don't know if it's from paper charts or memory." Mr. Johnson says if Letby had seen this, she would have escalated it to a doctor. Letby replies, "I can't comment on what time the doctor came." Mr. Johnson says almost 24 hours earlier, Child I was found almost dead, and then this incident happened. He asks what Letby would have done. Letby replies, "I would have escalated it to someone senior, like a doctor." Mr. Johnson shows the doctor's note, which mentions, quote, "abdomen distended and mottled." Letby replies, "I can't say specifically what time I asked him to come. The note says he came at 5:55 a.m. Mr. Johnson says this would have been an emergency for Child I. Letby replies, "I don't believe it was an emergency. I believe it showed a decline." Nicholas Johnson: "You sabotaged Child I at about 6 o'clock, didn't you?" Letby replies, "No." A prescription chart shows Dr. Matthew Neame prescribed morphine sulfate for Child I, and the infusion was commenced at 5:50 a.m. A fluid chart shows, quote, 0530 abdo-distended ++ in Letby's writing. Letby says by 6 a.m. the oxygen requirement had gone up to 100% for Child I from 60% at 5 a.m. Letby had written, quote, "squeaky" for the oxygen level at 5 a.m. Letby tells the court this meant the air entry for Child I was not clear. Letby says squeaky air entry is not an emergency. Mr. Johnson says there is also expanding discoloration and a distended abdomen. Letby denies copying the word squeaky for the 5 a.m. oxygen column from Dr. Neame's 5:55 a.m. note. Letby says she recalls Dr. Neame saying the mottling was unusual. She cannot, however, recall the mottling specifically. A report showed Child I's gaseous distension of the bowel had increased on October 14th since the previous X-ray on October 13th. Child I had been on a ventilator and nil by mouth. Letby denies injecting air into Child I. Nicholas Johnson: "You had inflated Child I with air, hadn't you?" Letby replies, "No." At 7 a.m, Child I had a significant desaturation. Letby's notes, quote, "reintubated at approximately 0700, initially responded well, abdomen firm and distended, overall colour pale, x-rays carried out." Nicholas Johnson: That is because you were sabotaging her, isn't it? Letby replies, no. Letby says she does not remember the 7 a.m. desaturation with any clear detail. Mr. Johnson moves on to the final event for Child I, when she died on October the 23rd. Prior to that, Child I had been moved to Arrow Park Hospital before returning to the Countess of Chester Hospital's neonatal unit. Mr. Johnson shows Letby observation charts for Child I from the previous day. Letby accepts Child I's observations were stable, save for one slightly raised respiration rate reading. She agrees Child I was self-ventilating in air at this point. She accepts Child I's abdomen was, the previous day, soft and non-distended. Nicholas Johnson: would you agree that despite 3 life-threatening events in the previous 3 weeks that Child I appeared to be in a stable condition? Letby replies, yes. For the night of October 22nd to 23rd, Lucy Letby is a designated nurse for a baby in nursery room 2 and 1 in room 3. Ashley Hudson is the designated nurse for Child I in room 1 and 1 other baby. Mr. Johnson tells the court the baby in room 2 went to a hospital in Stoke during that night shift. Letby says there were staffing issues which were not ideal, which were a contributory factor in the treatment of Child I following the collapse, in that a doctor had to be called away during the event. Letby said, quote, considering what Child I had been through, she was a poorly baby. The doctors were not with her at all times once she deteriorated. Letby adds she believed Ashley Hudson was capable of looking after Child I for Child I's nursing needs at this stage. The neonatal schedule for that night is shown to the court. Letby sent a message on October 22nd at 8:47 p.m. to a colleague, quote, unit nice, transport on the way to take my baby back to Stoke, only 8 babies, off duty, not out, kiss. Mr. Johnson says this refers to the baby he mentioned earlier who was transferred out during that night. The court hears that transfer process, noted as completing at 1 a.m, is not a 5-minute process and takes time and involves family communication. Child I collapsed at 11:57 p.m. Letby denies falsifying a note for the Stoke transfer baby prior to that at 11 p.m. The court is shown a nursing note by Ashley Hudson, which the court heard was timed at 10:57 p.m. Quote, long line removed due to constant occlusions, neonatal nurse Lucy Letby unable to flush, so Reg Rachel Chang informed. Dr. Chang had written for the Stoke transfer baby at 10 p.m, the baby was safe for transfer. Letby's note for this baby was written at 10:50 p.m. and completed at 10:52. It included a documentation of a long line infusion with a 10% dextrose fluid. Letby has co-signed the document. Mr. Johnson says the original 2300 reading has been changed to 2400 by Letby. Letby said the 2300 reading was an error and it was changed to 2400 as the correct time. She adds, quote, the charts are there for everybody to look at. Letby denies falsifying a fluid balance chart for the Stoke transfer baby. Mr. Johnson asks if Letby recalls what Ashley Hudson said for the 11:57 p.m. desaturation. He says Miss Hudson gave evidence to say Child I was crying, making a noise she had not heard before, different to a cry for hunger. Letby responds, I did not hear that cry at that point. When I entered that nursery, she was quiet and apneic. Letby says for this event, it was a case where one of the 3 nurses on duty that night would have had to come in and assist in room 1. Letby says she does not recall Ashley Hudson going to call for Child I's parents. Letby says there is an error on the IV chart and the time has changed. Nicholas Johnson: 3 different mistakes on 2 different babies? Letby says she does not know who wrote in the different times. Nicholas Johnson: how do those sorts of mistakes happen? Letby says when the unit gets busy we can make errors on the paperwork. Nicholas Johnson: we? Or you? I don't believe it would have been me. We'd have both been there for it. Or is it you altering medical records to put some time between you and a serious event for Child I? Letby replies, no. Letby adds, "I did not deliberately falsify any paperwork." At 1:06 a.m, Child Eye was crying again, the court hears. Letby recalls Child Eye was crying, but cannot recall being there by the cot side first. She accepts she was in the nursery. Mr. Johnson asks if Ashley Hudson was called over by Letby. Letby replies, "She might have been in the nursery when I called her, I couldn't say." Letby adds she could have come in, as her defence statement says, from the other part of the nursery. Letby says she had her hands in the incubator, quote, "trying to settle Child Eye." "My assessment of Child Eye at that time was she was hungry and rooting." Nicholas Johnson: "You had pumped her full of air." Lucy Letby: "No." "You were doing your best to kill her." "No." Lucy Letby states, "I have never injected air into any baby." Nicholas Johnson: "Do you remember interrupting Child Eye's mother?" Lucy Letby replies, "No." Mr. Johnson says Child Eye's mother, in agreed evidence, recalled Letby was, quote, "smiling and had talked about how Child Eye had enjoyed her bath." Child Eye had been bathed as part of the bereavement process following her passing. Nicholas Johnson: "Why did you say that?" Letby replies, "It's trying to, in that awful situation, it wasn't meant with any malice. We still talk to them and treat them as if they were alive. It wasn't joking or malice, it was trying to reflect on a happier memory." Nicholas Johnson: "How can you say such things?" Letby replies, "She had her first bath when she was alive and that was what she enjoyed, not the one when she passed away." Nicholas Johnson: "How do you know it was her first bath?" Letby: "Because I was there, we took photographs, it was a big occasion." Mr. Johnson asks how many baths Child Eye had in Arrow Park. Letby says she cannot say. Nicholas Johnson: "You were getting a thrill out of the grief and despair in that room, weren't you?" Letby replies, "Absolutely not." Mr. Johnson moves on to the case of Child J, a baby girl born on October 31st, 2015. Letby, in her defence statement, said she had never seen a baby with stomas before at the Countess, and other doctors were, quote, "equally unsure about stomas, and the parents were actually more proficient than the Countess staff at dealing with stomas." A handover sheet was taken to Letby's home. The defence statement adds, "unintentionally." The night shift rota for November the 26th to 27th is put up. 2 Band 4 unit nurses are named in the rota. Child J was in room 4, the designated nurse was Nicola Dennison, a Band 4 nurse also looking after one other baby in room 4. Letby was a designated nurse for 2 babies in room 3 that night. Letby rules out staffing levels as a contributory factor in Child J's collapse, nor medical incompetence, nor staffing mistakes. She says the unit was busy at the time, but was not a contributory factor. She adds she does not know how Child J collapsed. Letby accepts the evidence from Child J's mother that Child J was well and about to go home in a day or 2. Letby adds, however, there was an issue with Child J's stoma care, as it had been discussed among the nurses that they had little experience. She adds she does not want to name any names on any specific nurse's lack of experience. Mr. Johnson refers to Nicola Dennison's previous experience with stomas, which she said in evidence she had experience of it. Letby says over the years she did not recall any other babies with stomas. Mr. Johnson says Band 4 nurses, as said by Letby in evidence on May 16th, should not be involved in stoma bag care, as they would be unfamiliar with the procedure. Letby said, quote, "The unit was very busy, and we had to use staff where we could." Letby says she was not referring to Nicola Dennison specifically, but the nursing situation overall. Letby says there was not an issue over staffing levels at the time of Child J's collapse. Asked to explain a text message she had sent to a colleague, Letby tells the court, "Sometimes I felt nurses would take on roles which I didn't think they were trained enough in." The next message adds, quote, "It's shocking really that they are willing to take responsibility for things that they have no training or experience on, etc. don't think they appreciate the potential difficulties. Letby agrees she believed it was potentially dangerous. Mr. Johnson says the impression of the court was that Band 4 nurses were not qualified in stoma care, and the hospital was cutting corners by assigning such nurses to those tasks. Letby agrees. The court is shown a document about the duties for special care babies such as Child J, which includes stoma care. Lucy Letby. You need to appreciate the context that the unit was not familiar with stomas. Nicholas Johnson. This nurse was familiar with stomas, wasn't she? In her opinion, yes. Mr. Johnson says Letby was deliberately creating the impression to the jury that the care for Child J was deficient. Lucy Letby. I do think that. I don't think that she had a high standard of care. I don't think anyone was overly confident in saying, I know what to do with a stoma. We were led by the parents. Mr. Johnson asks why Nicola Dennison was not challenged about this. Letby replies, I can't answer that. Letby, when asked, denies not being happy in nursery room 3 or being happier in nursery room 1. Letby accepts the evidence of Nicola Dennison that babies in room 4 should have the light off overnight as they are due to go home. Mr. Johnson says 2 pairs of events for Child J happened, 1 pair in room 4, 1 pair in room 2. The room 4 instance happened at 3 a.m. and 4:57 a.m. and the room 2 instance happened either side of 7 a.m. Letby accepts this was the case. The court is shown a night shift staffing rota at the end of the night, in which Child J was in room 2. Letby is asked if she has any memory of the earlier pair of incidents. She says she does not have a recollection. She says from her memory, Child J had a seizure and was moved to room 2. She says she could be mistaken in her memory. The court is shown a apnea Brady fit chart for Child J on November the 27th, recording events for Child J at 4:40 and 5:03 a.m, recorded by nurse Nicola Dennison in nursery 4. The desaturations are recorded by Dr. Verhees. Letby recalled when she was called into room 4, Child J was fitting, not desaturating. Letby accepts that by 6:28 a.m, Child J had been moved to room 2, as a text message written by her to a colleague had said that was the case. Letby says she cannot recall where she was when she sent the 6:28 a.m. message, whether she was in room 2 or not. The message added, quote, "Only 5 staff!" Mr. Johnson. So it was all hands to the pump then, as the twins had been admitted to room 1 as an emergency? Letby replies, yes. Mr. Johnson says all staff would have been concentrated in room 1. Letby replies, not all, but most, yes. You were not involved in that, were you? Not from memory, no. Mr. Johnson says the message sent at 6:31 a.m. would have meant Letby would not have been in room 1. Letby agrees. Letby says Mary Griffiths would not have been in room 1 as she was not an intensive treatment unit trained nurse. She denies she would have been the last nurse in room 2. Letby accepts from looking at the neonatal schedule she would have been in room 2 when the emergency twins were admitted to room 1. Nicholas Johnson. There would have been a lot of distractions, wouldn't there? Letby. I don't know what you're implying. The medical staff would have their attention focused on the twins, and any help that could be spared would have gone on the twins. Do you accept that a lot of help was needed? Letby replies, it would be normal practice to get in the consultant when we only had the registrar. Yes. Dr. Gibbs arrives at 6:34 a.m, earlier than normal for his shift to assist. The last message Letby sent to her colleague was at 6:49 a.m. The colleague sent 3 messages which were not replied to in the following minutes. Nicholas Johnson. That's because you were in nursery room 2 sabotaging a child, weren't you? Letby replies, no, I wasn't. Letby accepts that, on the neonatal schedule, she is not recorded doing anything in the half hour prior to Child J's collapse at 6:56 a.m. Mr. Johnson refers to Dr. John Gibbs' notes of, quote, sudden desats to unrecordable levels at 6:56 and at 7:24 bradycardia, both associated with clenching of hands, stiff limbs, and on the second occasion, eyes deviated to the left. Nicholas Johnson: "This was your doing." Letby replies, "No, it wasn't." Letby accepts it was an emergency situation and Dr. Gibbs had to be called away from room 1 to child J in room 2. "You took your opportunity when all resources at the NNU were concentrated on the twins who had been admitted as an emergency." Letby responds, "No." Letby accepts evidence had been heard saying there was no known cause for child J's deterioration. Letby had care of child J the following night, which the court is shown from Letby's notes for that night, nothing happened. Mr. Johnson moves on to the case of child K, born on February 17th, 2016. Letby said in her defence statement she did not recall the events of February 17th and did not recall saying to Dr. Ravi Jairam that child K had just started deteriorating. She said she had done nothing to interfere with child K's tube or the alarm. She added the Countess neonatal unit was not capable, given its staffing levels, of looking after a baby of child K's gestational age. Letby tells the court she has no memory of such a conversation with Dr. Jairam. She says it is difficult to dispute Dr. Jairam's recollection of the event as she had no memory of it. She denies she has changed her version of events since starting to give evidence. Letby is asked if she understands the reason why child K was born at the Countess. Letby replies, yes. Mr. Johnson tells the court it was deemed too risky to transfer child K and her mother to another hospital at that stage, and that was why child K was born at the Countess. Lucy Letby: I don't know why more effort was not made to find a bed for her elsewhere. Nicholas Johnson: You have persistently given the impression that the Countess has taken on babies it is not able to look after, and that is why they collapse. Letby replies, yes. Is that the reason you said to the jury you didn't understand why child K was born at the Countess? Letby replies, I don't understand why she was born at the Countess. Is it to bolster your defence? No, I understand why she was born there, but I don't necessarily agree with the decision to have her born there. Letby says she does not recall the latter two desaturations for child K and does not accept Dr. Jairam's evidence in the first desaturation. Mr. Johnson says he will deal with these in a different order than chronologically. He will cross-examine on the second desaturation first. Letby says she does not know what happened to child K, so does not cite staffing levels as a contributory factor in child K's desaturations. She says she feels potentially the ET tubes were not secured for child K. The second desaturation occurred at 6:10 to 6:15 am on February 17, 2016. The court hears a note on child K's birth and assessment was typed up by Letby on a computer from 6:04 to 6:10 am. The note would have been taken from paper charts taken by the cot side. Nicholas Johnson: You were at child K's cot side a minute or two before she desaturated, weren't you? Letby says she would have got the notes from the cot side at some point prior to her typing them up.